American solution exists in the airline industry. We have right now in the hospitals 1 jumbo jet crashing every week. Why don't we have it in the airline industry? Secret is simple. Number 1, we have a black box. Black box has no conflicts of interest. It has no bias, it's impartial. It tells us exactly why the plane crashed. Number 2, we have an FAA. An FAA has regulation and authority over every single aspect of the airline industry, whether it's a captain, a mechanic, flight attendant, or management, or the manufacturer. And thirdly, we have NASA's aviation safety reporting system that allows anyone in the industry to report anonymously any problem. The healthcare industry does not have a black box. The healthcare industry does not have an FAA. And the healthcare industry does not have NASA. In conclusion, Mr. Chairman, we need to ask ourselves if we want our odds to be better than going to a casino. And we know casino always wins. John Kennedy once said, "My fellow Americans, ask not what your country can do for you. Ask what you can do for your country." Mr. Owens, you asked me to hopefully tell you what the government can do. The government has 3 branches. This is bigger than just the executive. There's the executive branch, there's the legislative, that is the judiciary. I've spoken to the executive branch, the Department of Justice, and other branches. They don't have always the jurisdiction. If you take Medicare, Medicare only applies to patients 65 years and older. I have yet to see in my practice a patient 65 years older ask me to help her get pregnant. So there is no quality control jurisdiction from CMS that I know of for any patient under 65. What we have is a healthcare holocaust. Over 6 million patients died in the last 30 years as a consequence of errors and complications, not as a consequence of the disease. And anyone who thinks the status quo is an option, I would like to remind them what Edmund Burke, a philosopher from Irish philosopher and statesman, said: "All that is necessary for triumph of evil is for good men to do nothing." It's also interesting to note that cynics say, and that's the last I will share, is actually the uninsured may be lucky. This is really strange, a paradox. Why? Because they're less prone to be exposed to errors and complications. I thank you very, very much for inviting me. I thank you even more to indulge in the time that I've had.